Assalamualaikum and good afternoon, Dr. Faiz.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay,
My name
Ahmad.
is
Oh,
Faiz bin Daud.
Faiz bin Daud. Okay, Doctor. So, how are you, Doctor, today?
Alhamdulillah, it's been a pleasure for me to see four young, energetic future leaders of Malaysia.
Okay, so now we all want to know what is your age currently this year?
Oh, what's my age?
Yes.
I have two ages.
Whoa. Okay. We like to hear the first ages.
Okay. My biological age
Okay.
is 38,
Okay.
but my heart age is 25.
Okay. I see. I see. Okay, so what is your occupation?
My occupation is as a medical lecturer. So we are involved in the medical teaching of undergraduate students as well as postgraduate students.
Mhm.
We are also involved in the clinical work in the hospital. So I believe our friend Azhari, whose sister Dr. Intan,
Yeah.
she is one of my top students in UKM.
Mhm. I see.
Therefore, I see there is no opportunity for Azhari and his team members to not to be the top students for this professional English session.
Thank you, Doctor.
Thank
We
you,
will strive
Doctor.
to meet your expectations.
We will try.
Anything else that you would like to know?
Okay, the last question for our introduction. So, how long has you been a doctor?
I became a doctor in since 2006. I graduated from the International Islamic University of Malaysia. We were among the pioneer batch from UIA, and then I proceed with my postgraduate studies and obtain a master's in public health from Sydney University, Australia. Ever
Australia.
since then, I have lectured in UKM, specifically Hospital UKM. Oh, but now we have a new name. It's a HCTM, Hospital Chancellor Tuanku Muhriz.
Oh,
Hospital Chancellor Tuanku Muhriz.
Mm-hmm.
Okay, Doctor. That's all for our introduction. Now we will proceed for our Interview session.
Yes.
For our first interview question. So, how will IoT revolutionize pharmaceutical manufacturing?
Can you please rephrase that?
How will IoT revolutionize pharmaceutical manufacturing?
Pharmaceutical
Pharmaceutical.
manufacturing.
Yes.
revolution.
Well, number one, I do not have direct experience in the pharmaceutical industry.
Mm-hmm.
Because if you are looking specifically into the pharmaceutical industry, then you should be interviewing those in the pharmacy background or those in the drug companies. And the best person who or people that would give you a good insight on this would be those in the NPRA. NPRA is the National Pharmaceutical Regulatory Authority. That is a body under KKM, Kementerian Kesihatan Malaysia, and they are based in Petaling Jaya.
Oh, I see.
However,
Mhm.
I do see that Internet of Things have played a big role in the advancement of any pharmaceutical products. If I may share with you some of the um, things that happens or in the hospital. Okay, this is not directly to in the pharmaceutical industry, okay, but possibly in relations to the pharmacy services in the hospital. The normal practice is, of course, a doctor would prescribe medications, and we all know that doctor's prescription or doctor's handwriting is the worst in the world. Penulisan doktor ni memang cakar ayam. Therefore, prescription error may occur. What I meant by that is, let's say for example, the doctor wants to prescribe anti-hypertensive medication 3 times a day. Okay, we have an old drug, an old medication, nifedipine, which can be given to patients 10 milligram TDS, meaning to say that 1 tablet 3 times a day. So the doctors need to write that on paper in their prescription that this particular medication needs to be taken 1 tablet 3 times a day. So if the handwriting is not good in the sense that it can be misinterpreted by the pharmacist, okay, they may provide the medication 1 tablet twice a day, or possibly one tablet once a day, or possibly they can give out to the patient 2 tablets 3 times a day. So that will definitely cause an overdose.
I see.
So the practical issue to overcome this, among others, comes in the implementation of the HMIS, which is the Hospital Management Information System, whereby the doctors would just prescribe from a computer system, and it is predetermined, meaning to say the doctor just need to scroll down from a list of medications. Therefore, the possibility of a prescription error to occur is minimized. So this is good for the patient as it safeguards their interests. It is also good for the doctors because doctors still don't know how to improve their writing. And it is good for the pharmacy because the exact prescription or the exact amount of medication or the exact name of the medication can be retrieved from the system. So all in all, this would prevent a prescription error, thus safeguarding the safety of the patient.
I see. Okay, so doctor, can you give us an example of machine that has helped revolutionize the pharmaceutical scene?
Oh, okay. Again, I'm not in a position to steal any machine
Okay.
because I'm not sure what works in the background in the pharmacy. Okay. However, I think among the invention or that have definitely assisted the healthcare workers would be the hospital management information system. Okay, so that is also connected to the pharmaceutical management system, whereby previously the pharmacist needs to jot down manually on paper the number of medication that comes in and the number of medication that goes out. Then they move on to the usage of Excel. Okay, that is again uh, possibility to be some error to be made, because anyone can make changes to the Excel sheet. So once the PIH, the Pharmaceutical Information System, PIS, okay, was installed, therefore the number of medications, the quantity of medications, the uh, can be tracked, okay, in real time.
In real time.
This is so much so because if you look in the hospital, you take an example HCTM itself, we have like 4 pharmacies throughout the hospital. Okay, one is the main pharmacy on the lower ground. We have another one, another pharmacy for specifically for the ONG and pediatrics. We have another satellite pharmacy on level 1, which is for the ophthalmology, ENT, and dental. And I think there's another satellite pharmacy on level 7, okay, which caters for other units and departments. So a centralized pharmaceutical information system would allow the pharmacist to keep track of the medications. One is the number of medication, the amount of medication. Secondly would be the location of the medication, whether the medication is in the store pusat, the central store, or is it in the various satellite pharmacies or in the main pharmacy. So among others, this provides information in real time.
I see. So doctor, do you believe that the implementation of IoT devices managed to help regulate the flow of the information between hospitals?
Okay, so I think from a technological standpoint, it can be done. Meaning to say hospital A, hospital B, hospital C, hospital D, and hospital E. Okay, let's say we have 5 hospitals. They can interconnect with one another. Okay, it's just like banks. Okay, when you go to the ATM machine in Kedah and you make a withdrawal there, and you go to the same ATM machine here in Selangor, the amount that has been withdrawn can be seen. Okay, is updated. Or if someone in Puchong put some money into my account, then I'm in Bangi, I can check online that the money has been deposited by Nabil.
Yes.
So all in all, the technology and the infrastructure is there. However, in the medical field, there is some lag in its implementation. Among others is because of the regulatory framework. The medical records of patients needs to be safeguarded. It cannot be shared by third party. Therefore, that is why patients' information is still kept in the premise. Meaning to say, if they got treatment from Hospital Serdang, the information stays in Hospital Serdang. If the same patient goes to Hospital Kulim, the patient needs to inform the doctors and the healthcare workers of all the investigations, of all the previous medical history to the doctors attending him in Kulim Hospital. By right, with a click of the button, the doctors in Kulim Hospital should be able to retrieve the medical notes or medical records from Hospital Serdang. It can be done, the technology is there, but as I mentioned, it's because of the regulatory framework which does not allow such information to be shared. So coming to your question, you said asking whether sharing of information among hospital is good. Yes, we do agree it is good. It can also be done. However, the law, and then now we have the PDPA. Are you aware of PDPA? PDPA is the Personal Data Act.
Protection.
Protection Act. Yes, PDPA. Personal Data Protection Act. Okay, so the regulatory framework needs to adhere to the PDPA. It needs to adhere to the sanctity of the patient's information, and we have to observe the privacy of the patient themselves.
Okay, so doctor, has there ever been a situation where there was a miscommunication between hospitals regarding critical information? And if there was, what happened?
Kindly elaborate on that.
So there has a situation that is miscommunication between hospital A and B regarding some critical information like maybe the patient from hospital A has a specific disease. So if that happen, so what will the hospital do to solve the miscommunication?
Okay.
Uh-huh.
Miscommunication always occur. We try to minimize it, okay, with several methods, okay. So the formal form of communication between one healthcare facility and another healthcare facility, okay, is through a referral letter. Okay, I'm sure you have had experience, okay, whereby if you or your family members fall sick, you go to the doctors, then the doctors will write a referral letter, and you bring that referral letter to the next healthcare facility, okay, either the hospital or the klinik kesihatan or the GPs. Okay, so on the referral letter, the doctors will usually write all informations related to that particular patient, at that point in time. Okay.
Mm-hmm.
So, however, if patients do not obtain the referral letter, then obviously the patient needs to retell the whole story. So in Malaysia, the scenario that we see is that patients like to go shopping for doctors.
Yes.
I'm sure you have had your experience. You are sick, you go to Doctor A, and then you do not recover. The next day you go to Doctor B.
Yes.
And you still do not recover, then you go to Doctor C. By the time you reach Doctor C, then you recover. So the conclusion that you make as a patient is that Doctor A and B is not good, but Doctor C is good.
Yeah.
So that is a misconception on the patient side.
Mm-hmm.
The actual reason is by the third day, whatever virus is within you has already resolved. So that is
Mm-hmm.
you recover.
Mm-hmm.
It so happened that you meet Dr. C, and that particular Dr. C spend 20 minutes or half an hour with you. So you say, oh, Dr. C is good. So likewise, it is quite similar. In any healthcare facility, be it in government or private, okay, the last treating doctors, okay, would always be viewed as the ultimate hero.
Yes.
Anything else?
Uh,
Yes, yes. For the next question is how can information technology help reduce healthcare costs?
Oh, can you rephrase that again, Nabil?
How can information technology IT help to reduce healthcare costs?
Oh, various methods.
Yeah.
My personal experience is by having I run a small GP practice. Okay, so number one, we see it saving healthcare costs in the sense that I reduce the number of staff. Okay, last time I required 5 staff. Now I'm running with only 3 staff.
Mm-hmm.
Okay, so that itself have reduced uh, the overhead on my part. Okay, secondly, when I utilize the computer management system or healthcare management system for the clinic, we save a lot of space. Because last time we need to prepare one room just to keep the medical records.
Yes.
Okay, so because it's on paper and pen. Okay,
Yeah.
and then by law, okay, by the medical act we supposed to keep those medical records for at least 7 years from the last visit by the patient. So meaning to say, if I were to treat Izzat today in my clinic, okay, and that is the first and the last time that I see Izzat, that particular folder or medical record on Izzat has to be kept in my premise until 2027. And I
7 years.
tell you, we have a lot of Izzat.
Yes.
Yes.
Izzat is just one person, but we have a lot of patients just like Izzat lah,
Mm-hmm.
coming from one doctor to another doctor to another doctor.
Mm-hmm.
Okay, so you can just imagine the amount of space, okay, that was required. So in my particular practice is that we managed to come up with the room that was previously used to keep medical records. Now since all the medical records are now being kept online, okay, online in the sense that it's kept in the server within our premise. So the room has been utilized for a surau. Okay, so it allows our staff to pray in a much more comfortable manner. Okay, and it also allows our patients when they come for their clinic to get treatment, so they would come with their family members and they can utilize that as an added facility. On the other hand, okay, this hospital or clinic management system also save costs because we reduce reliance on paper and pen. Okay, yes, any other questions?
What cost has been drastically reduced due to the advent of IoT in the medical scene?
Oh, okay, like I mentioned earlier, the cost savings that we had was more on the operations. Okay, the
Yeah.
operational cost, because we save a lot in terms of our OPEX, our operating costs. The number of staff is greatly reduced. We also created various or new spaces. Okay, so that in other words allow us to save costs in terms of electricity. So all in all, we have saved quite a significant amount of operational cost.
That's good. Okay, then are the doctors well trained with the latest equipment and are able to explain how the procedure works?
Equipment. Okay, I can only refer to the hospital management information system. That itself, from our experience, it takes about 2 years to fully implement its usage. Okay, because that hospital management information system does not um, uh, it's not just for one user. Okay, all the healthcare workers, even the administrative workers or administrative staff will also need to use that particular system. So the usage of this system has to be implemented in several phases. Okay, I think all in all we had like 4 phases. Okay, the first 6 months is the phase 1, the second 6 months is phase 2, phase 3, and phase 4. Okay, so we started off, of course, with training, and that during the first 6 months, then because once it's launched, we cannot launch or just at the pharmacy, or we cannot just launch at the registration counter. We cannot just launch at the consultation or doctor's side. Okay, it has to be launched together. Okay, so that's why we divided it into several phases. So all in all, I would say to get optimum usage, okay, for the system, okay, or for the transition between from a manual system to a hospital-based or clinic-based system, roughly takes between 1 year to 2 years.
Mm,
Anything else?
okay,
Uh,
but what happen if a doctor or nurse is unable to operate those latest equipments?
Okay. My personal experience when I was working in Hospital Serdang, you know that Hospital Serdang is a fully computerized hospital. Okay. What happened was it occurs basically among the more senior doctors. All the senior
Mm,
doctors who are aged above 50 at that point in time, they are very afraid of utilizing this hospital management information system. So what they
mm,
did was, okay, when you are in your clinic, okay, the doctor is supposed to be treating the patient. Okay, you take all the history, you write down the notes. Okay, now instead of writing down the notes, we type out the notes in the computer system, and then let's say the doctor wants to order an X-ray, for example. So in the manual environment, we would fill in an X-ray form. Okay. However, in the um, computerized hospital, we need to fill in a form in the system itself. And next, we would like to prescribe the medication. Last time we used to write a prescription, but now we have to type out the prescription or choose from a drop-down menu in the system itself. So these senior doctors, they said the system is slowing them down, is very difficult to use, and blah 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 blah. So what they did was they take the more junior doctors, okay, like me, okay, to sit in the room with them to see the patients. So the junior doctors like myself at that point in time, we need to become their PA, personal assistant, or become their typist. Okay, they just instruct, they just tell, okay, you write this down, A, B, C, D, E, and Z. So we just type it out. Then we have to click, we have to order the X-ray, then we have to order the medications and close the case. So that was very challenging because we have a lot of patients. So if the specialist, the more senior doctors, you pull the younger doctors to do this clerical work, so it is not utilizing our expertise. Okay, we are doctors, so we are not typists. Okay, so the reason they cannot use or they cannot utilize staff nurse or or the admin staff is because staff nurses have other jobs to do and there's no other healthcare personnel. So that was among the challenges. That is only during the first phase of implementation. Once the senior doctors are retired, then things will be much better. Yes, anything else?
Okay, thank you, Doctor.
Doctor, so in your point of view, what is the usage percentage of IoT devices that is used when making or developing a new vaccine, such as in this time we are facing the COVID-19, so does IoT play a role in making or developing the vaccine?
Okay, thank you very much, Azhari, for your question. Again, I must stress out that in the hospital, we do not make vaccines. We do not test for vaccines. We only utilize whatever vaccine that has been made in the labs. So, when the preparation, the trial, the lab test is best for you to ask the drug companies. Next, please.
So, does the presence of IoT mitigate the risk of human errors, such as like patient monitoring?
Okay, during this COVID-19, there has been a lot of IoT applications which was brought forward to Hospital Chancellor Tuanku Mukhris. Okay, I would be very happy to share with you. Among others, UKM itself, we launched robot Makcik Kia. Okay, so robot Makcik Kia ni is actually, it is a very simple robot. It is just used to deliver food, okay, to our COVID patients. Okay, because you know that once a patient is COVID positive, they will be isolated in the ward. Okay, so every day the doctors, the nurses needs to go and meet them, treat them. Okay, so you cannot be meeting them without the proper PPE. Okay, PPE is the personal protective equipment. Okay, if you go and look in Google up, there's some head cover, there's mask, there's a face shield, There's an N95 mask. Okay, you have to be full attire, full gown, double layers, gloves, and shoe cover. Okay, so if you want to put on that, okay, that itself costs a lot and is very uncomfortable. Okay, so we reserve that for the doctors and the nurses. So how about the food handlers? Those people who are going to serve the food. Okay, obviously COVID patients also need to eat food. Okay,
Yeah.
Yeah.
so all this while, those that serve the food are the workers from the canteen. Okay, from the kitchen. Okay, they would deliver all these food items and later on collect them. So if we want them to put on all this PPE they want for serving the medication, then it's impractical because in one ward you have 30 patients. So don't tell me
Mm.
you want to use 30 times PPEs.
Yeah. Of
Okay,
course, no. Yeah.
right? It will be an absolute waste. That's one thing. Secondly, it's impractical. I serve one meal to Ahmad Amin Nudin. Then I get change again. I go and serve to Nabil. Then I change again. I give to Azhari. Then I change again. I serve to Afiq, and I change again and serve to Almani. So it doesn't make sense, right?
Yes.
We work out with a company, so they came up with this robot makcik Kia. So this robot makcik Kia basically is a tray of food, okay, whereby it is powered by battery and it is wheeled. It's like a remote control. Like you play remote control, a car remote,
Uh,
a small remote control, right?
Yeah.
yeah.
Yeah, so that's how it works. We
Mm.
create a robot that holds all the food items, and then we just use a remote control, go from one patient to another patient. So we save
Uh,
the exposure of our healthcare worker from COVID-19. We also save the usage of PPE, the personal protective equipments, and we also allow the innovative minds of our young engineers
Mm.
come up with this.
That's good.
Yes. I can share with you a bulletin that we have on that. I share with Afiq later on.
Okay,
Okay.
okay.
thanks, doctor.
Okay,
Thank you,
Mhm.
sir.
You may put it in as your one of your reference.
Okay.
Okay. Anything else?
Okay, Doctor, I'm next. For me, during a pandemic situation, does the presence of an IoT infrastructure able to lighten the burden of stress and fatigue from doctors and nurses?
Yes, it should be able to minimize the role of healthcare workers. Okay, so basically we want IoT to be able to assist in healthcare delivery. Okay, what can IoT do to assist the doctors, to see the nurses, to help the nurses? So we also have a second robot, okay, that was introduced to us in HCTM during this COVID-19 pandemic. However, this was it comes from a private company. Okay, if I'm not mistaken, it is brought in from it was built from overseas and brought to Malaysia. Theoretically, it is good. Okay, in the sense that the robot can be um, that does not require the use of PPE, and then the robot will go to each particular patient, and then the patient will take a stethoscope and then put on themselves. So the doctors in the room, okay, in the next door room can hear, can auscultate the lungs and the heart, and they also have like a small video conferencing, okay, whereby the doctor is in the next room and they can talk like how we are speaking and conversing together now. Okay, I can visually see you and hear you, and likewise you can do the same. Other than that, it also tried this particular robot was introduced to us, but is not being used in HCTM.
Okay.
Next,
And
please.
have you ever been in one of those situations then?
What situation?
During the pandemic.
The like this lah, like this current MCO, the PKP. During the
What he means is, have you ever been in a situation where you were burdened by so much stress, but due to the presence of an IoT device, the burden that you carried was lifted. Have you ever been in a situation like that?
Okay. Thank you for rephrasing the question. Is that no, I have not been in that particular situation. Thank God. Okay. However, our frontliners, healthcare staff who are working in the COVID wards, they work 12 hours a day. Okay, they only have 2 shifts. Okay, so it starts from 7 a.m. in the morning, okay, till 7 p.m. And then the next shift comes in at 7 p.m. until 7 a.m. That is how things work in the hospital. Whether this IoT device can assist in reducing the possible stress level, I don't know, and I have yet to see. It is also needed and required for us to do that 12-hour shift is because we want to reduce the contact with the patient. Okay, if we resort to normal working hours, 8 to 5, 5 to 10, 10 to 7 the next day, okay, so we have more people, more staff nurses, more doctors who are exposed to these COVID patients. We don't want that to happen. Okay, so I pity these healthcare workers who are working on a 12-hour shift daily, every day, bukan selang sehari, 2 hari tau. Setiap hari,
Every day.
I pity them, but I do not know any IoT gadgets that have assisted or alleviate their their situation. Next, please.
Okay. Continuing on with the next question. Will higher implementation of IoT devices help prevent a pandemic in the future by streamlining the procedure of producing and distributing the vaccine or cure?
Yes, again, in terms of the producing and delivering the vaccines is out of my expertise. So I am not in a position to answer that particular question. Thank you.
Oh, okay, I see. Then, last but not least, our final question. In your opinion, can IoT devices help regulate safety and quality guidelines that is required to develop a vaccine or medicine?
Thank you. I believe there is a role for IoT in safeguarding the testing and the development and testing of vaccines. Okay, as we know that vaccines are being conducted in the labs, okay, and these labs are there are several level of labs. Okay, if you've heard of BLS level 3, BLS 4, okay, these are different categories of lab whereby the security of the lab, the cleanliness of the lab, okay, allows for certain procedures or certain investigations to take place. So IoT may assist in the prevention of transmission of these viruses to the workers in the lab. Things like authorizing the healthcare personnel into the lab, having a clean room before entering the lab, having a unique identifier, okay, when a person enters the lab and as the person exits the lab. Okay, so I believe if this is being used, it may have a good effect. Okay, a good thing for the healthcare workers.
Oh, okay. I see. I see.
Anything else, boys?
Since that was our last question, Doctor, thank you. You were able to answer most, if not all, of our interview questions. And they say that time is worth its weight in gold, but the knowledge you have imparted upon us has been invaluable. 1,000 applause to you, and we as a group would like to thank you for your patience and understanding.
Thank you very much, Izzat. Ahmad, oh, I noticed that all of you have 3 names. Izzat Ilmani Aminur, Ahmad Aminuddin Amir, Afiq Izzuddin Kamaluddin. Siapa ni? Muhammad Azhari. Oh, 2 nama saja. Orang lagi? Nabil?
Nabil Helmi.
Muhammad
Muhammad
Nabil Helmi.
Helmi.
Nabil
3 nama
Helmi.
Okay, it's my pleasure to spend some time with you. I hope the information would be sufficient for you to come up with an adequate and successful write-up for your professional English module. I wish you all the best. May Allah reward you handsomely, and please strive for excellence, especially for the nights of Laylatul Qadr,
Yeah.
InsyaAllah.
so
Alhamdulillah.
that you will achieve
InsyaAllah.
excellence both in the world as well as in the hereafter.
Okay, thank you, Doctor.
Thank you. You're welcome.
Okay. Bye, Doctor.
Assalamualaikum.